Hey, hi, I'm Tim O'Reilly. I'm the founder and CEO of O'Reilly Media. And I want to kick off this track we started here at OSCON on open source in healthcare with a little bit of context, both on why I'm interested in healthcare, but also on some of the big trends in technology that I think should shape our thinking as we try to apply technology to healthcare. So first off, I came to the area of health IT through the work I'm doing with government. I started out just having this sort of crazy idea. It was sort of Barack Obama had been elected, and I was kind of excited about the possibility of change. And I started talking to people in Washington about how technology could have an impact. And it was kind of interesting. I wasn't sure what I was going after. I knew that there was this interesting thing bubbling up about social media and government, cloud computing and government. But I got some really good advice from Eric Schmidt, CEO of Google. He said, Tim, what you're really good at is going and talking to a lot of people and then telling us what you heard. And so I went and I talked to a lot of people in government, and what I came back to in the end was a kind of geeky story that I thought, this is never going to resonate. But it was this idea that government needed to change from delivering applications to being a platform provider. And what I meant by that is really evident today in the smartphone market, with the way that Apple transformed that market by opening up the iPhone platform. They wrote 15 or 20 applications themselves, just like everybody else. But then they created this platform, and all of a sudden there's more than 200,000 applications for the iPhone, and the entire market is revolutionized. And so I started seeing all the signs of how this was happening in government. Some of it has been around for a long time, and we just don't give the government credit. We're all so proud of our smartphones with their location-based services, and we forget that those GPS satellites were put up by the U.S. Air Force originally. And there was an interesting moment, actually, a piece of history as I looked into it, that led me to the statement that Ronald Reagan is the father of Foursquare. Because it was in 1983 that a U.S. airliner strayed into North Korean airspace and was shot down. Those of you who are older probably remember that little piece of history. Many of you don't. And it was at that point that Reagan said, we really need to turn this technology over for civilian use so this never happens again. Now, at that point, the GPS satellite system wasn't completed. Again, an amazing piece of history. Just nobody believed in it. It took a long time. I mean, the first idea first came out in I think it was 1969, although it was even then drawing on even earlier ideas. And it wasn't completed till the early 90s. And it was actually President Bill Clinton who signed the executive order fulfilling the executive order that Reagan had written, which was just kind of in the future when it's finished, we should do this. Bill Clinton actually did it. And you think about all that came from that decision, all these location-based services. So that was a great example of how government could act as a platform provider. They didn't get into the, GPS business. I guess they did for the military and people like that. But civilian GPS came from the private sector, and eventually it percolated all the way through into our phones. And I think there are a lot of other examples like that. Weather data, comes collected by the government, also crowdsourced, all kinds of interesting ways. But it's then fed out as a platform. The government doesn't actually operate the weather channel. The private sector does. So as I was going around, I started collecting these stories about how government could act as a platform, how government is acting as a platform, how it is enabling innovation in the private sector to sort of multiply its effectiveness. And I ended up finding that some of the most remarkable stories, both of what was happening and what could happen, are in healthcare. Now, healthcare is, of course, at the forefront of a lot of our minds because there's this huge healthcare debate this last fall about expanding access to care. But it's also on our minds because all of us know that our healthcare system is broken. there are no feedback loops in the system. There's no incentive to cut costs. There's no incentive to reduce unnecessary procedures. It's such an example of our old way of doing government out of control. And yet, there are such amazing signs of hope. Because for the first time, we are making a commitment to electronic health records. And what's most interesting about electronic health records is that they are a fundamental platform innovation that will allow the system to change. Now, we're a long way from where we need to be. But think about it this way. When you go to the doctor's office and you see that big wall of paper files, you don't have access to that data. It's very hard for you to get it. With electronic records already, you can start to have your prescriptions, your lab results sent to your Google Health account or your Microsoft Health Vault or just emailed to you. So there's that personal data access element. There's the opportunity for information to be shared between institutions so that when you have you're transferred from one doctor to another, they get the information easily. But more than that, there's the possibility of the kinds of feedback loops in the system that have been so powerful on the web. When Google gives you search results, they're taking the data from crawling the entire web, but they're also taking data from all the people who are searching, who are clicking, who are telling them, yeah, I like the third result better than the first result. And so they start moving the results because there's a feedback loop there. And we actually have data in our system that would allow us to reduce the cost and improve the outcomes in healthcare. We know in the data that some procedures don't work, that some hospitals cost 3 or 4 times as much as another and are less effective. It was an eye-opening article in the New Yorker, I think it was last year, by Atul Gawande, in which it was turned out that the city in the United States that has the highest healthcare costs also has the worst outcomes. And it was Todd Park, who's the Chief Technology Officer at the Department of Health and Human Services, said this was a holy cow moment for healthcare in America. And he said his goal at the Department of Health and Human Services is to build a holy cow machine, where we can actually learn, we can see what's working, we can see what isn't working, and we can start to change the behavior of the system in the way that we build web apps that change in response to the way users see them and respond. And it's that future, that potential that I see in health IT. We're at the beginning of a revolution. That revolution starts with medical records, but it also starts with something that you see on the sort of the hacker enthusiast frontiers, and that is a revolution that we're seeing in the quantified self. There are already consumer devices that allow us to track various things. You can buy a device to track your sleep patterns. You can various devices that will track the amount of exercise you get. I've lost 20 pounds in the last year by carrying a Philips Direct Life monitor, which told me that I was sitting around too much, and I started taking all my meetings walking around, and it made a huge difference to my health. Because I was able to measure. I have a scale that I step on. It reports my weight and graphs it up on online. And I recently, was talking with my doctor about it, and I could actually send him, a picture of, my weight loss, and we could talk about it. These are, coming from the consumer end, and they're telling us about fascinating possibilities. A new startup I heard about recently is one to help track whether elderly patients or other kinds of patients are taking their medications. It's a sensor-enabled top to a pill bottle. All it reports is whether the pill bottle was opened or not. But you can then say, oh yeah, this person hasn't taken their medication today. They can't have because they didn't open the bottle. And of course, that's part of this whole world of the Internet of Things, which is coming our way. So all these trends converging to make health IT an incredibly fertile and exciting area for innovation, one that can have an enormous impact. And so back to my time in Washington, I was fascinated to see how much open source software was at the heart of the thinking about how to make a smarter health care system. On the one hand, a lot of open data efforts coming out of the Department of Health and Human Services. They have something called the Community Health Data Initiative. It's been renamed. There's a hackathon, the Health 2.0 Data Challenge, where they're trying to figure out, within certain kinds of privacy constraints, how to release certain types of Medicare data in ways that will enable analysis, will enable that holy cow machine. By the way, that Health 2.0 challenge, if you Google for it, great if anybody wants to hack on that. Very, very helpful. The other thing that we did was not just to try to create new apps, but to get that data used in existing apps. So, for example, there's been an app, a web app for years, HHS Hospital Compare, that tries to use some of the healthcare data and the outcome data and patient satisfaction surveys to rate hospitals. So you can say, in my area, which hospital is the best. But not that many people use it. And I talked with Todd, and I said, well, what we really need to do is get that data out to the ways that people are doing searches today. But now, as a result of our connecting the dots between HHS and the private sector, that now influences hospital and doctor search in Bing at Microsoft. Right? So Microsoft is now taking that data and using it to inform their algorithm. Now that's kind of another example of how we can use that. But over on the other side, this idea of electronic healthcare records, the design of the system is really a testament to this thing I'm talking about as platform thinking, in the same way that, say, the GPS network is. Because it turns out that before the healthcare bill, there was another important bill that created some momentum around healthcare, and that is in the Recovery Act. There's a huge pot of money set aside for electronic healthcare records. And what's really interesting is the way that money was set aside. It's not set aside in the way that I think most people imagine the government sets money aside. We're going to put $20 billion towards building this enormous infrastructure. We're going to take, for example, the VA system or Medicare, and we're going to build the Mondo system built by Beltway bandits, and we're going to roll it out to all Americans, and that is, the vision of which all the pundits were calling Obamacare. No, the reality on the ground is that there's a couple of small groups that are convening open source projects about health data interchange. One of them is called HHS Connect. We're going to hear about that today. And there's Nindirect, another one. They're designed for slightly different use cases, but they're very complementary. And they're looking at using existing open source technology. They're looking at the most minimal subset of standards that need to be agreed on. And then they're putting a big pot of money out, $20 billion or more, in the form of direct incentive payments to doctors, to hospitals, to medical practices, if they implement what's called meaningful use of electronic healthcare records. And they're not telling people how to get there. They're not saying what software to use, how they should do it. They're just saying patients have to be able to get their own records. Patients have to be able to get records from one doctor to another. There's various kinds of tests that are really just outcomes. And so then they're building minimal mechanism. They're creating incentive around outcomes, and then they're saying out there to the private sector, which could be anybody from open source projects to community health exchanges to for-profit companies, you figure out how to fill that gap. We want you to use these open standards for exchange, but we're going to let you, the marketplace, figure out how to deliver this to consumers. In just the same way, for example, that the Air Force put up those GPS satellites, did the hard part, made sure that it all worked consistently, and then let the marketplace go to town. And I think that's a really remarkable story about how government can partner with the private sector to enable a new kind of innovation. And I am really, really excited about what's happening in this space, not just as a revolution in healthcare, but as a revolution in how government can use IT effectively to help the future happen in a new and powerful way. And I'm really excited that you're here today. We have an amazing group of presenters who are going to talk to you about their projects, about their perspectives on what's happening, why it matters, and really drill down into the details of some of these initiatives that I think are going to make such an impact on our healthcare system, and eventually, I hope will be used also around the world. So thank you very much.